The next thing that we're going to do is we're going to stand her up, and I'm going to show you how easy it is to find a subluxation in a spine. Subluxation can not only cause pain, but it can cause dysfunction. That vertebrae, when it moves out of position, subluxation, less than a complete total dislocation of a vertebrae, a subluxation can cause many, many things, because that vertebrae has a foramina between the vertebrae that called the intervertebral foramina, which expresses the nerve. These nerves go to target organ systems and control function. Not only is there a nerve involved with the intervertebral foramina, there's also a blood vessel, a meridian system, a lymphatic system, and a dural connection. The dura is the skin of the brain and the spinal cord. So we have nerve, blood vessel, lymphatic vessel, meridian connection, and dural connection. 5 factors involved with each intervertebral foramina. So we're going to go through and show you how easy it is to find a subluxation, number 1, to correct it, number 2. Number 3, we're going to show you how we differentiate between a subluxation and a fixation, which is a vertebrae that's stuck and lost its motion. The fixation is not causing an interference in those 5 factors, the intervertebral foramina, the nerve, the blood vessel, lymph, the meridian, or the dura, but it's movement in the joints that keep circulation, which bring oxygen and food. Lack of motion causes stress, wear and tear. The pH of the tissue changes, and guess what happens to the joints? They start to degenerate. As they start to degenerate, the body starts to build calcium in there. You end up with osteoarthritis, degenerative dehydrated discs, which crack, leak, and fragment, and away we go. So a fixation isn't as important to correct as the subluxation, but it's a close second, and we're going to show you how we fix those in 1 second. Stay tuned. Okay, so we found she was all-weak syndrome caused by pressure of the atlanto-occipital joint on the brainstem. We corrected that. We found that she had meridian stress on the left side of her body caused by a virus and a parasite-type bacteria. We found that the vol points tested for lungs, which needed a drainage formula to clear the mucus in the lungs, and also the spleen on the left side of her body, which showed up earlier on the exam as being a meridian on the left side of her body, the spleen meridian's on the left. And we found that she needed a drainage formula for the spleen and also a formula to rebuild the spleen. Now we're going to go through and show you how easy it is for me to find a subluxation fixation, which I've already talked about. The key with this, if I hadn't balanced her already, doing this test would be nonsense. It would be science fiction at best. You have to balance the nervous system first, because what we're using to test her is her nervous system. If it's out of balance, then we get, it lies to us. We get errors. So let's have your face against the table. And you can lean forward and be strong here. So we have a strong indicator muscle. Put your right hand here and be strong. And she's strong. Put your right hand there and be strong. And she goes completely weak with her right hand on her ischium and her left hand on her sacroiliac. We'll come back to that. Hand off your body. So now I'm going to go in here and I'm going to rock or tap the sacroiliac. I want to know if it's fixated. Be strong. And she's strong. Left side. Strong. So if I rock or tap a fixated joint, a strong muscle will go weak. So now I'm going to touch the vertebrae, the spinous point of L5. She goes completely weak. Be strong. See that? Nothing there. I go up to 4. She's strong. 3. She's strong. 2, 1, T12. She's all strong. But if I go to L5, she's strong. Now I want to know if L5 is also fixated. Be strong. And it is. Natalia has a rotation of the pelvis and a subluxation fixation of L5. Now, curious, if there's a subluxation of L5 and that nerve goes to a specific organ system and a specific muscular system, can we identify a muscle that's involved with that? So let's look at that. We know L5 is involved with the hamstrings, be strong, and be strong on the right side, and be strong. And she's strong. We know it's involved with innervating the gluteus maximus. Hold up. I'm going to push down and hold up. Completely weak. Let's try the right side and hold it up and be strong. And she's bilaterally weak in the glutes, one of the strongest muscles of the body. What does the glute do? Moves you up and forward. That's why sprinters have what? Glutes, because they are going up and forward quickly. So we're going to go ahead and put her on the chiropractic blocks to, nope, let me do it. And there and there. And then we're going to adjust her sacroiliac on a medium setting. You'll notice the first impulse, there's a pause. That's the computer figuring out what to do. Now it took quite a while for it to actually move that sacroiliac joint on the right side. So I'm going to take her off the blocks. Now the question is, okay, she has the subluxation fixation of L5. If it's rotated, it is rotated in what direction? So we'll do what's called a challenge. So I'm going to test a strong muscle, be strong. Then I'm going to take the fifth lumbar with my hand, and I'm going to push it anterior on the right side, be strong. She's strong. I'm going to push it anterior on the left side, and she goes completely weak. So that tells me that this vertebrae is subluxated on the left side, so we'll adjust it accordingly, again on a medium setting. So it took me 3 impulses to get that to clear. Now I'm going to go through and adjust it on both sides at the same time to clear the fixation. So now we're going to recheck the subluxation of the pelvis and the subluxation fixation of L5. And put your hand there and be strong. That was weak, now it's strong, hand down. Now I'm going to touch L5, be strong. Subluxation is corrected. Rock or tap the L5, and the fixation is corrected also. So now we're going to take her down. Remember, she had bilateral weakness of the gluteus maximus muscle because of the impingement and interference with the nerve roots at L5, S1. So down we go.